Hi, welcome all. Good morning and good evening. This is the agenda for today. So this is weekly connect 4. We are going to start with Swamiji's session and 20 minutes of his guided meditation. Sorry, we just changed it. Give me a second. Yeah, we are going to talk about. Dr. Susheel is going to talk about low BP. So we remember we talked a couple of times. We talked about high blood pressure, but there were a few questions on low BP. So Dr. Susheel is going to talk about low BP for about 10-20 minutes, followed by Q&A. And then we thought quite a bit of people who have joined, get them introduced, because the existing people, we are all connected multiple sessions continuously for a month, alternate days we joined. But wherein the new join is recently whoever joined, they directly got an access to e-module, and we are sitting here in week wise. So we thought it's important for them. We need to get to know each other. So we are going to request all the new joiners. I think Karthikeyan yesterday spoke to quite a bit of people. Whoever is there, I do have the names, and please put on talk about just basic introduction about you. So with that, we'll close today's session. That is the agenda for today. With this, we'll move on to Swamiji's session. Swamiji, over to you.
Namaskar. Welcome to all our esteemed IWSP participants. Beautiful, calm, quiet hours of the day, beginning of our day. The quality of your day depends the way you begin your day. That's where we say, well begun is half done. If you start your day with all the great practices, with the ultimate practices for health and wellness, it will definitely make your day a wonderful day. Meditation, Dhyana. We very well know Dhyana is the 7th step as taught by Maharishi Patanjali. Yama, Niyama, the basic disciplines. What to do, what not to do. Ahimsa, Satya, Steya, Brahmacharya, Parigraha, Shaucha, Santosha, Tapaswadhyaya, Ishvara Pranidhanani, Yama, Niyama. Asana, Pranayama. Do your yogasana regularly. Pranayama. Practice pranayama with a focused mind. Ekagrata ke saath asan pranayama. Then comes the 5th step, pratyahara. Stay away from all those things which are going to disturb our meditative life. Connect with all the good things. Dharana. Constantly think about the goodness. When you are done up to this, now you are prepared to practice meditation, Dhyana, 7th step. If we can practice Dhyana properly, we attain the state of Samadhi, God realization, self-realization, experiencing the joy within, bliss within, Ananda. As we also keep on talking, previous century belonged to medication. Whenever we had some physical or mental or emotional disturbances or diseases, this century belongs to meditation for all the challenges or problems of life, physical, mental, emotional, intellectual. Sri Ramakrishna said, God realization should be the goal of life. We fix up so many things as our goal of life. It's okay. Immediate needs are to be met and we keep it as a goal and we work for it. After attaining that, what next? What next? So when you keep on questioning, we get an answer from inside. Let us get the ultimate thing. When you get that ultimate thing, you will not require anything else. Go and get the ultimate, highest, by getting which you will not need anything more. With this brief background, now let us practice meditation together. As we say, constant flow of thoughts towards our real self. Pure consciousness, God, is called meditation. It is the highest technique to realize ourselves, to realize God. So, we are beginning our day with the highest technique, ultimate method to know ourselves, to know our real nature. As we know, the first step in meditation is to settle ourselves. Please settle yourself in a calm, quiet room, a room which is ventilated properly, fresh air. A place which is neat and clean, with a photo of your Ishta Devata or a Jyoti, light, a symbol of God, pure consciousness. After making these basic preparations in your room, if you are able to sit on a chair, that's fine. Or if you can sit on the ground like me, in the squatted position, that's good. Sthira Sukham Asanam, that's what is important. Posture is very important as a first step in the meditation. Fix your body. Sthira Sukham. At the same time, you should be comfortable in that position. There should not be any sort of strain, stress on any part of the body. Be relaxed, be comfortable at the same time, be in a fixed posture. Close your eyes. close your ears, close your panchendriyas, which have a natural tendency to go out. By closing, you are directing your panchendriyas to go dive deep within. Go dive deep within. That's what meditation means. अपने भीतर, अपने आप के अंदर जाके झांक के देखना, अपने भीतर में सब कुछ है. We have got everything deep within us. Let us go dive deep within. Sthira Sukham Asanam. Eyes closed for outside world, open for our inner world. The focus is on the breath, deep and long breaths. The fresh air, pure oxygen, the prana shakti, the divine energy is entering through our nostrils, tip of the nose, through the trachea, reaching the alveoli, the basic unit of lung, which is very vital for our respiration. Proper respiration, proper inhalation and exhalation, breathing. When it is done with regular practice, deep and long breaths, when the respiratory rate comes down, it helps to calm down the mind. A calm and quiet mind is very, very vital for our meditation. This is called as Sarala Pranayama. Sthira Sukham Asanam. All the panchendriyas directed deep within, closed for the outside world, open for our inner world. At the same time, very alert. Focus on the breath. Now let us pray for the health and wellness of all the beings. I'll pray, you send these mental vibrations in all the directions the way I guide. May all the beings in the east, in the west, in the north, south, above and below, in all the directions, wherever they are, let them be at peace. Let them be happy. Let them be in an ultimate state of health and wellness. Sincere prayers, when done, they work. It does miracle. By praying for the peace, happiness, health and wellness of all the beings, we experience a sort of contentfulness, happiness, peace, a state of health and wellness deep within. A contentful, a joyful, a peaceful mind is very important for our meditation. Whenever we attempt to do good things, we need the blessings of the Lord, elders, the higher power. So let us go and offer our Sashtanga pranams to all the Avatara Purushas, all the Rishis, all the great saints, all the noble teachers, all the great people who are constantly working for the wellness of the society. By offering our Sashtanga pranams, we have received the blessings. Blessings of the elders, noble people, great teachers, gurus, rishis, avatara purushas are very vital for our meditation. Sthira Sukham Asanam, deep and long breaths. Eyes closed for outside, open within. Calm and quiet mind, but at the same time very alert and focused mind. Ekagrata. Now we are going to enter our proper meditative phase. The place where we are going to meditate is our heart, spiritual heart. Just right to the physical heart, center of the chest, from where our bhavanas, emotions arise. There is the infinite space, Chidakasha. Go, enter your spiritual heart, go deep within, infinite space deep within. This body, the physical body of ours, is the temple of the God. This physical body of ours is nothing but the pure consciousness itself. Feel your body to be the embodiment of that pure consciousness. There, go deep, dive deep. Your Ishta Devata, your beloved Lord, who is nothing but that pure consciousness itself, Chid Ghana Murti, that pure consciousness which is everywhere, has taken a definitive form of your Ishta Devata, who is self-luminous, is seated deep within your spiritual heart. Go and offer your Sashtanga pranams to your Ishta Devata, Arama, Krishna, Arama Krishna, Vivekananda, Hanuma, Akali, a Jesus, a Buddha, a Ishvara, a Allah, your beloved Lord, Ishta Devata. Go and offer your Sashtanga pranams. Take his blessings. Look at his divine smile. He's so happy to receive you. He is our real. He is our own. Apta Bandhu, Sakha, Mitra. He is our real friend, guide. He's so happy to receive you. Be alert to listen to his voice. He can give any instructions to you anytime. Be ready to listen to his words. Our Lord is Parama Prema Swarupa. He is love personified, pure love. He is Sarvagya. He is the knower of everything, the present, past and the future. He is Sarva Shakta. There is nothing which is impossible for him. Everything becomes possible only because of him and his energy. He is Sarva Vyapi. He is everywhere, always protecting us, guiding us. Now let us meditate in silence on the divine qualities. Parama Prema Swarupa, Sarvagya, Sarvashakta, Sarvavyapi. Yadbhavam Tadbhavati. The way we feel, the way we become. Let us meditate on the divine qualities. Sthira Sukham Asanam, Sarala Pranayama, Ekagrata, eyes closed, outside, open within, alert mind, calm mind, quiet mind. A feeling of happiness, contentfulness by the blessings of all. We have entered our spiritual heart deep within. We are with our Ishta Devata, meditating on the divine qualities in silence. Om Shanti 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 Hari Om Tat Sat Shri Ramakrishna Arpanamastu. Let us offer our Sashtanga pranams to our Ishta Devata. Though we want to continue to be in this state of happiness, bliss with our Ishta Devata, we have to slowly come out because we have to proceed to our next activities. Slowly come out of your spiritual heart, feel your physical body. Let us be aware of our surroundings, where we are. Rub your hands, place on your eyes, neck. Slowly open your eyes. Eyes closed and meditating on our real nature, pure consciousness. Eyes opened, looking around that pure consciousness, joy, happiness, contentfulness, peace around. Eyes closed, meditating on our Ishta Devata. Eyes opened, trying to see everybody through those divine eyes, everything as manifestation of the Lord Himself. This is how we are going to spiritualize every day, every moment of your life. By spiritualizing every day, every moment of our life, we make our life a beautiful life, happy life, joyful life, life full of joy and happiness. Joy and happiness alone can give you the ultimate health and wellness. Both are interlinked. If you want ultimate health and wellness, you should be free from all sorts of pains, physical and mental suffering. If you have got health and wellness, you will be able to meditate more and more. You will be able to express the divinity, happiness, which is already within us, more and more in your day-to-day life and day-to-day activities. A true spiritual person is happy within and makes people around him happy. That is the ultimate medicine for all the disease of life. So let us remember this. Make a good habit of meditating daily, minimum for 20 minutes. Make a good habit of practicing pranayama, minimum for 20 minutes. Make a habit of practicing asanas, sukshma vyayama asanas, minimum 20 minutes. 1 hour for yourself out of 24 hours, so that you will make the remaining 23 hours in a beautiful, wonderful way. I'm so happy that many people are joining the e-module. We'll be talking to a few of those newly joined IWSP participants towards end of the session. Now, over to Naresh ji for the proceedings. Namaste.
Thank you, Swamiji. Before we get into the Q&A session, we'll listen from Dr. Susheel also, and then we do have few questions. We'll take them up. Dr. Susheel, over to you.
Thank you, Naresh. Thank you, Swamiji. Okay, can you see my slides?
Yeah.
Okay. So last time we talked about high blood pressure, how to take care of that, and some questions came about low blood pressure. So Swamiji suggested that I should actually do a whole presentation on low blood pressure. So a couple of things you need to know. Arbitrarily, there is a cutoff limit based upon numbers for normal blood pressure and low blood pressure. A normal blood pressure is 120/80. If it goes below 90 systolic and 60 diastolic, we call it low blood pressure. But this is, remember, this is just a number. This number has relevance only if you have symptoms. So if you have no symptoms, then this has no relevance. The lower the blood pressure, remember I told you, the lower the blood pressure, the better. But if the low blood pressure gives you symptoms, then that is a problem. The other thing you need to know is majority of the people actually have a problem of high blood pressure and not of low blood pressure. Now, why does this concept of low blood pressure, this myth of low blood pressure become so prevalent, especially in India, is if you have blood pressure of 100/70, right? So by definition, it is a little low. Now, if somebody has fatigue, weakness, and all those issues, say, oh, because my blood pressure is low. No, this is not a causal relationship. It's a coincidental relationship. You just happen to have low blood pressure, but your fatigue may lie somewhere else. Remember, I keep saying the commonest cause of fatigue in our life is over caloric consumption. Overeating and eating too much sugar are the commonest reasons for fatigue in our life. But sometimes if the blood pressure is low, it can genuinely give rise to the symptoms, and fatigue is one of those symptoms. Okay, the other thing you need to know is you have, let's say you have hypertension, high blood pressure, and you check your blood pressure. Or you just have a blood pressure instrument and you're just playing with it and you check your blood pressure. You'll be amazed how much your blood pressure fluctuates during the day. So just to give an example, my blood pressure usually stays around 106/70. So I have by definition lowish blood pressure, right? But when I go on a treadmill or I exercise and I've checked myself, my blood pressure goes to 130, 140, 150, 160. And if I'm running 170, 180, I have taken my blood pressure up to 200 if I do intensive exercise. So blood pressure fluctuates a lot. So do not be worried about that. It fluctuates by body position, it fluctuates by stress, your physical conditioning. After eating, blood pressure goes sometimes down, sometimes up, time of the day, how you're breathing at any given time. If you've done exercise and you're breathing hard, your blood pressure goes up. If you're calm, your blood pressure comes down. If you're dehydrated or sweating, it goes down. If you're fully hydrated, it goes up. If you take certain medication, it goes down. So blood pressure fluctuates a lot. So for you to declare yourself that you have low blood pressure or high blood pressure, be mindful of the fact that the blood pressure fluctuates a lot. So you should have that reading consistent on a daily basis for 3 days in a row for you to say what it is. So don't just declare yourself if you get a low reading, oh, I have a low blood pressure, right? You check it on 3 consecutive days. Same thing holds true for high blood pressure. Don't say you have high blood pressure unless you have a consistent reading of 140/90 or above, 3 consecutive days in a row taken in the same spot with the same instrument. So what are the symptoms? If acutely blood pressure drops, and the acute blood pressure drop is, let's say you have an accident and you lose blood, right? That's one. Or you get severe vomiting and diarrhea from some infection, or you have severe infection in the body, then your blood pressure drops acutely. The sudden drop in blood pressure. It gives you symptoms of dizziness, lightheadedness, fainting, blurred vision, fading vision, nausea, fatigue, weakness, lack of concentration. Now, chronically low blood pressure usually does not give you symptoms because body has tremendous adaptability. It adapts to low blood pressure and somehow obviates these significant symptoms of low blood pressure. So what are the conditions? When you get pregnant, generally, because in pregnancy, remember, you have a fetus in your body that is growing, and the fetus has blood. So if the fetus has blood circulating in it, you have to have more blood in the system. Your volume goes up, your blood vessels dilate, and in pregnancy, sometimes the blood pressure can drop. Sometimes in pregnancy, paradoxically, because of toxemia, blood pressure can go up. So it can go both ways, but normally a physiologic pregnancy drops the blood pressure a little bit because the blood vessels dilate. If you have some kind of heart disease, heart damage, or heart failure, blood pressure can go down both because of loss of muscle and also because of medications. There are certain endocrine conditions, especially Addison's disease, that can lower your blood pressure when your endocrine gland, the adrenal gland, is not secreting certain hormones that are required. If you're dehydrated, like people that get cholera or severe gastroenteritis, their blood pressure drops significantly because the blood volume drops. Or if you bleed a lot because of injury or accident, your blood pressure drops. Now, poor nutrition, especially the ones that become folate and B12 deficient, they become anemic and their blood pressure drops. So the answer to that is supplement folate, and the best source of folate is green leafy vegetables. Infections can cause drop in blood pressure through septicemia. Some allergic reactions, if you're allergic to something and you take it, suddenly you'll notice that people drop their blood pressure significantly. Now, if you're diabetic sometimes, and you've had high blood pressure for a long time, and suddenly you notice your blood pressure becomes well controlled and then starts going down, you become happy, but actually it's a bad sign. What this means is that your diabetes chronic has become so severe now that your nerves are getting damaged and your autonomic nervous system is becoming dysfunctional, blood is pooling in your legs and your blood pressure is dropping. So that drop in blood pressure in diabetics usually is a bad sign. That simply means that you're developing diabetic neuropathy, a complication of uncontrolled diabetes. So there are some medications that can lower blood pressure. So obviously, you know for sure that all medicines that you take for blood pressure lower blood pressure. And if you're taking too much, right, then your blood pressure can go down. Now, those of you who have hypertension, high blood pressure, right? And you're taking medications, right? 1, 2, or 3 medications you're taking for blood pressure, depending upon whatever is your blood pressure reading. And your blood pressure is well controlled. So you have hypertension, your blood pressure is now 120/80. You're very happy and you're taking 3 medicines, but you've joined IWSP. Now, doing IWSP, your whole system is going to change. Your sodium is going to go down. Your volume is going to go down. By yoga, meditation, and pranayama, your autonomic system is going to improve. By change in diet, your vascular endothelium is going to improve. So what is going to happen is your blood pressure is going to drop. If you keep taking those 3 medicines, you'll find out that you're getting the side effects of low blood pressure. So gradually, in consultation with your doctor, then you may have to start dropping your blood pressure medications, right? So as I say, if you're taking 1 or 2 blood pressure medications and you follow all the instructions that we gave you on control of blood pressure with lifestyle modification, remember, Naresh, please put that slide again for everybody on the IWSP, those 8 practices that I talk about for lowering blood pressure, 40 millimeter of mercury. Remember, if you switch to the whole food plant-based diet, you lose 5 millimeters of blood pressure. If you give up sodium salt, you lose 5 millimeter of blood pressure. If you switch to potassium salt, you reduce your blood pressure by 5 millimeter. If you start aerobic exercise, you lose your blood pressure 5 millimeter. If you start strength training, you lose your blood pressure 5 millimeter. Now, if you're doing yoga, you lose your blood pressure. Pranayama, meditation, you're losing your blood pressure. If you lower your stress, you're losing your blood pressure. And if you give up alcohol, you're losing your blood pressure 5 millimeter. So all these practices, IWSP, actually bring your blood pressure down. So you're going to start having side effects of low blood pressure. So that's why I wanted you to know the side effects of low blood pressure. So what do you do in that case? Instead of 3 medicines, you cut down to 2. Instead of 2, you cut down to 1. And eventually, if your blood pressure becomes 120/80, you give up your blood pressure medicines. As simple as that. If you have neurological condition called Parkinson's disease, some of the medications that you take for Parkinson can also lower your blood pressure and cause complications, especially all these dopaminergic medications that you take, L-Dopa, methyl-Dopa. These medications lower blood pressure. And that is why Parkinson patients suffer a lot with this low blood pressure. And then antidepressant, both through relieving anxiety and as well as through their effect, they can lower blood pressure. And there's some erectile dysfunction medications like Cialis or Viagra that you take these days that can also lower blood pressure. So be mindful of these medications and their interactions with your system that lowers blood pressure. Now, what are the types of low blood pressure? So what is called postural. The postural low blood pressure is if you change your posture. Let's say you're laying down and you stand up. So I told you already, I have low blood pressure. If I bend down to pick up a golf ball after putting, or I go on my toes and sit squatting for a little while and then get up, I get lightheaded because my blood pressure usually 106/70. And if on a golf course, if I'm dehydrated or been exercising for a long time, it drops further to 90 or 80, and I feel like I'm something like this. I go dark. But that's normal. I know this. So I make sure that I hydrate myself and take care of that. So it's postural. This postprandial also, if you have low blood pressure, after eating, it drops more. Why? Because when you eat, your gut needs more blood. It's called splanchnic dilatation. The blood supply goes towards gut because you're going to be metabolizing, absorbing all these food particles. So the blood volume circulating in the blood drops, and then your blood pressure goes down. And then there's also a neurogenic blood pressure drop. Especially, you must have seen, now, I don't know whether you saw that or not, but when I was growing up in school, I knew when you used to have prayer meeting outside, there are 500, 600,000 students in my school. We all used to stand and pray together outside, and we used to have our, I remember my school prayer, Asatoma, Satagamaya, Mrityorma, Mritam Gamaya, and followed by that, there used to be thought of the day, then there'll be some principal will come and talk something, and it's going to be heat. And invariably, I used to see 1 or the 2 students will do, boom, goes down. I don't know if you remember that or not. You must have seen this. That is a common faint called vasovagal or neurogenic syncope. Some people, their autonomic nervous system is such that after prolonged standing, it gives way and the blood pressure pools in their legs and they fall down. So this reminds me of a patient that I had, one of my neighbors in my old neighborhood. He was a pharmacist and his daughter was a very good student and a basketball player in school and very good athlete. But every third or fourth day on a basketball court, she'll faint, and that becomes very disturbing. And he went here and there everywhere, and he saw people, and he also did some tests, a special test. And this was established that this is vasovagal syncope because she had a tilt table test, which was positive. So what you do is people that have common fainting, you tie them down a table and you keep raising the table straight, and leave it there for 30, 40 minutes, and their blood pressure pools in their legs and they faint. But since they are tied to the table, they don't fall off, but you get the diagnosis. So this special test is called tilt table test to find out about neurogenic syncope. So what did I do? Because, she's a white girl, white lady, white household. They don't eat too much salt. So I said, look, increase the salt intake, but they could not eat salt. So I had to prescribe salt tablets. In America, salt also comes as 2 gram, 5 gram tablets. So she started taking 2 5-gram tablets a day, and she never fainted on the basketball courts. So her blood pressure that was 60 or 70, by taking the salt tablets, became 120. And she never fainted. So now, please listen carefully. There is a beautiful lesson here. So I treated this girl with salt and brought up her blood pressure from 70 to 80 millimeter to 120 millimeter. Then the opposite is also true. If you give up salt, you'll also drop your blood pressure. See how profound the effect of salt is. Salt was a blessing for her because her blood pressure is very low. But you must understand the lesson here. If you have hypertension, the salt is a poison for you. So if you switch the sodium salt to potassium salt, you lower your blood pressure by 10 to 15 millimeter of mercury. So if your kidneys are normal and you gave up sodium salt and you switch to potassium salt, you eliminated one medicine from your blood pressure medicine. As simple as that, right? Okay. The nervous system damage also causes problem. I had this also as an example. I struggled with a patient of mine for a long, long time, and his wife was very intelligent, so she helped me manage this patient. But what he had Parkinson's disease, although he didn't have some complex thing called Scheidegger syndrome, but he had Parkinson's. So I told you already, Parkinson medicine drop blood pressure. He also had a blockage in his carotid artery for which he had surgery. He had carotid endarterectomy. Sometimes you do that surgery, you end up damaging some nerves. So some branches of the laryngeal nerve, which is part of the vagus nerve, the autonomic nervous system, can get damaged. So his blood pressure fluctuates tremendously. His normal blood pressure is 200, then it goes to 80, then it goes to 180, then it goes to 60. Fluctuated like that 10 times a day. So I had to have a special regimen for him and a medication to increase blood pressure. There are actually also some medications called metodrine and fludrocortisone. Fludrocortisone increases blood volume, and midodrine actually constricts the blood vessels through nervous system and increases blood pressure. In rare cases of low blood pressure, we use those medicines. So I had to use those medicines on him to control his blood pressure. But the long and short of this is this: from hypertension point of view, high blood pressure point of view. So today you learned that low blood pressure can cause problems and symptoms. If the low blood pressure does not cause symptoms, it is not a problem. Most of the low blood pressure occurs in acute situations, and low blood pressure in itself is a benign condition. It is not going to kill you. It is going to give you symptoms. It's going to give you weakness, dizziness, and all those things. But it has no effect on your longevity. Remember, I keep saying this over and over again in my talks. The lower the blood pressure, longer you live. Higher the blood pressure, it shortens your lifespan. Okay, so I'll take some questions now.
Thank you, Doctor. Just you may share.
Okay.
So I have few questions came in. What is the relationship between blood pressure, heartbeat, pulse, and breath? Is there any linkage with all?
Absolutely. Tremendous linkage, beautiful linkage. So remember in one of the talks, I said this, that there is a vagus nerve, right? And it's called vagus. You know, the word vagus comes from Latin vagabond. Vagabond is a person who is like going all over the place. So vagus nerve goes all over the place. It supplies just about every important organ of your body. It's supplying your lungs, it's supplying your heart, the blood vessels, the kidneys, the livers, the pancreas, the gut, all the way down. It supplies. And this is one nerve that takes stimuli to your brain. And this is a very important component of your nervous system, autonomic nervous system. And your heart and your breath and your blood vessels, remember, are all supplied by it. So if the blood vessel is affected, it sends signals to the vagus nerve. If the heart is affected, it sends signals to the vagus nerve. If the heart rate is affected, it sends signals to the vagus nerve. So there's a complex interplay between them. So without going into the details, if you somehow stimulate your vagal system, your parasympathetic nervous system, what it does is it lowers your heart rate, it lowers your blood pressure, it lowers your respiratory rate. And that is the yogic practice of pranayama and asanas. And that is how the yogis prolong their life, by lowering the blood pressure. Remember, I don't know if you remember or not, growing up, I knew there's an anecdotal, mythological Hindu saying that the number of breaths that you're going to have in this life is counted. This much, right? So if you slow the breath, right, then you prolong the duration. Your count is same. So let's say you're breathing at 30 times a minute versus 15 times a minute, right? So hypothetically, if you even take this mythology right, that you have 100 breaths, hypothetically, you actually double up your longevity by just slowing your rate. So slower the heart rate, lower the blood pressure, lower the respiratory rate, better is your health, because more autonomic system is actually activated, and longer your life.
Right. What are all if there is any emergency medicine, somebody fainted out of low BP?
Yeah. So in a common faint, the neurogenic faint, right, where people just faint for no reason, especially young children, there's a very simple, very effective medicine. The reason they are fainting is because all the blood is pooling in the legs. All you need to do is lay them down on a flat surface, lay them down on the floor, and lift them up from the ankle and lift the legs as high as you can. In 1 minute, they'll wake up, because now all the blood that has gone to the legs is now draining back into the heart, and they wake up. So the simplest treatment for a common faint, anybody you see fainted, first thing you do, obviously you call 911, you call the emergency, right? Right. Second thing you do is you elevate the legs. When you elevate the legs, all the blood that is pooling in the legs goes back into circulation, and they'll wake up.
Right. So I personally experienced it. A few days back, I just measured my heartbeat before my meditation. After my meditation, I could see 15 drop in that.
Yeah, that's as profound as that. And that's good. That's good. So now, you do yoga regularly. You're doing meditation. You're doing pranayama. You probably follow IWSP more than I do, and so you will notice this. Your blood pressure will drop. Your heart rate will drop. Your respiratory rate will drop. That's going to happen.
Yeah,
that's a good thing.
So there is a question just came. BP alters why between 150 to 70 to 100 to 80. Which one is not damaging? Why? I mean, there is a range is given 150 to 70, 130, 80, 100, 80. It's keep altering. Which one is not damaging? Why?
So blood pressure damage is not acute. It's not like one reading one day is going to damage your blood pressure. It's a consistent reading over a period of time, years, that damages your blood pressure. So it's important for you to know that you check your blood pressure on 3 consecutive days in same condition, and take the average and know what your blood pressure is. And also take your blood pressure when you're not stressed, not after exercising, not after eating, not after stressing, those kind of things. So, but the normal fluctuation of blood pressure is a good thing and it doesn't damage you.
Another question is exercise and BP, how they are related? Because it increases heart rate, increases blood pressure, and then we are telling it is going to help us to reduce it. Probably
Yeah, that's a nice question. So when you exercise acutely, right, there is a metabolic demand because the muscles are not going to work. You're running fast, right? So there's a metabolic demand, and to meet the metabolic demand, the body has only three mechanisms, right? To supply more oxygen, it increases respiratory rate, so get more oxygen in the system. And it increases heart rate so that you take that oxygenated blood more frequently to the exercising muscle. So that's second mechanism. Third is it increases blood pressure so that you force it into the muscle deeply by higher pressure to give nutrition to that muscle. So heart rate increase, blood pressure increase, respiratory increase, and you notice all that when you exercise. That is the acute response. But once this is done and over with, the way exercises changes your skeletal muscle is over a long period of time, chronically, it lowers your blood pressure because now these blood pressures, the muscles become accustomed. So I'll give you an example, very simple example. Those of you who have actually done gym exercise, when you first go to gym, usually in January, when you take your New Year resolution, you start going to gym, you notice that if you go on elliptical or you go on a treadmill or one of those exercises and you hold it on and you get your heart rate there, right? You will notice that within 1 minute or 1.5 minutes or 2 minutes, your heart rate goes up. So I'll tell you, with my age, my 85% predicted maximal is 134. So if I stop exercising for a few days and I go to the gym, within 1.5 minutes, I go to 134. But if I've been exercising for 5 or 6 or 7 days, it takes me 4 minutes to go to 134 heart rate. So that is the adaptation that occurs. So acutely, yes, your respiration goes up, blood pressure goes up, heart rate goes up. Long term, it rolls blood pressure.
Yeah. Thank you, Dr. Sharma. It's an interesting topic. And thanks for creating awareness on this low blood pressure. We get a little scared of it, but it is what we understand is it is not as scary as compared to high.
It is never going to kill you. And if it's too low, just lay down, lift your legs up, it comes up. And if you're some person who is chronically low blood pressure like I am, so I keep my salt intake high. So you have same problem, low blood pressure, keep your salt intake high. We are fortunate that we have low blood pressure. Mostly it's the problem the other way around, high blood pressure and excessive salt.
Got it. So with this, I think I was just talking with Swamiji. There are quite a bit of new participants who have joined the direct module without joining our regular. We thought, I think it is important that we should get to know each other well. So one question has come. We'll close it and come to the next segment. Sorry for it. I'll ask this question now. Is it holding breath for longer time increases in BP? There is a question.
Why would you hold breath for a long time? I don't understand. I mean, doing the breathing exercise. No, it's good. It's actually lower your blood pressure. So I do that sometimes, and it's good. So whenever you do increase your inhalation, increase your exhalation, increase the holding time, all these three exercises of increasing blood, Rechak Purak and all that, as you call it in pranayama, is good because at each of these points, you're stimulating your vagus nerve. Activating vagus means parasympathetic activation. Parasympathetic activation means lowering of the sympathetic activity. Lowering of the sympathetic activity means lowering of the adrenaline level and cortisol levels. And once you lower those levels, then that is anti-inflammatory. That is what gives you peace, calm, lower blood pressure. So all the breath exercises that you do in pranayama, they're the best way of activating your parasympathetic nervous system. No, there is no harm in that. There's benefit.
In fact, I think Swamiji can comment a lot on this. After the Antaha and the Bhagya Pranayama, you feel the calmness. Yeah. It goes down and you feel relaxed and very calm and quiet. So the answer to him is it is not going to increase, rather it is going to reduce. That's the answer. The breath, holding the breath is longer time will actually slowly reduce your BP. Okay. Having a feeling that BP medicine prescribed without full investigation. Once BP medicine started, adopt to its possible or reverse stop medicine. Yeah, I mean that's I mean I don't know, India I see that even if the BPs become normal, they don't allow to
Yeah,
stop.
the reason for that is because they know that BP fluctuates a lot during the day. So one thing I recommend all my patients is please have your own blood pressure instrument at home. Check your own blood pressure on a regular basis and be guided by that. And again, my advice to those doing IWSP is that yes, your BP is going to drop. And you do have to have a consultation with the doctor, and you have to convince him that yes, instead of 3 medicine, now put me on 2, instead of 2, put me on 1. That is going to happen. And he's not going to believe it. And I tell you from my experience, okay, because I have patients referred to me, I'm a consultant. Patients are referred to me by primary care doctors. And then they go back and the patient's blood pressure is dropping. And there's one thing they tell those patients, that's fine. You listen to the doctor, he convinced you, you're doing all these things. But you know what? 3 months, 6 months time, you're going to go back to same eating your bacon and sausage and ham, and your blood pressure is going to go up again. Then what is going to happen? Then you're going to suffer. So don't do this, because I know that you somehow got convinced by this doctor, but you don't have willpower. And if that happens, and the reason they say that is because they are responsible legally if something happens to you. So you have to tell them, no, I'm doing IWSP. I'm not doing it for 1 day. I'm not doing it for 1 month. I'm not doing it for 1 year. We have been told that this is a lifestyle for life, and I'm doing it for life. And tell him to please work with me, cut the medicine down.
Got it. Got it. Thank you, doctor. With this, we'll move on. The idea is to have this new participants who joined recently, not in our batches. Just come on video. Just give us a brief introduction about you, your name, you're from, how do you know us, and any support you need, please. This is a forum. These are all family. We call it as IWSP family. So request one by one. And I do have name, but
Also, if you have any questions or concerns or any clarification that you need.
yeah, please. You can come on and then talk. I mean, you can unmute yourself and you can talk. Please do one by one, please.
Good morning, everyone. This is Ravi Shankar. I'm a civil servant working in Uttarakhand. I was introduced to this group by Swami Dayadhipananda ji, who happens to be at Haridwar. And I've been eagerly waiting to attend these sessions. Fortunately, I could attend it today. It was very useful for me, and being a civil servant involved in policy making, I wanted to know the various aspects of the IWSP, and so that I could learn and do whatever little I can do in the policy making sector. That is my intention to attend these meetings. Thank you so much.
Any questions, any concerns you have about any particular thing that we talk about and on the tapes and all that?
Doctor, I actually joined for the first time today. It was very interesting to listen to the session so far. Whenever I get any questions, I would certainly share it with you, Doctor.
Very nice. Yeah. So go through those modules that you have, and call us anytime or tell us anytime, because you are more useful for 2 reasons. Number one is that you will benefit your health, right? But you're also in a policy making, so you can also impact the health of a lot of people around you. So I think that you can make a lot of difference in the lives of other people. So it's nice, very nice that you joined.
Thank you, Doctor. Thank you so much.
Thank you. We'll put the helpline number also. Any support you need, just connect with us. We'll be more happy to help you. Anybody else?
Sure.
Yeah, namaste. Yeah, I'm Dr. Hema Patel. I'm practicing gynecologist at Rani Bennur and got introduced by Dr. Chandrasekhar Kelgar. I was into health and fitness, and still I wanted something to explore more. Especially, I got influenced by him, and when he told that this program is divided into like dash and it has so many different aspects, so I got interested and going through it. Hope it'll do. I'll be able to get involved still more, trying to inculcate all the good habits, especially in my platter. Still not up to the mark. Trying hard.
Good, good, very nice. Yeah. Any questions?
At present, no, sir. I think once I get, I'll get back to you.
Yeah, thank you.
Thank you. Thank you, Dr. Hema.
I just actually wanted to ask Swamiji, like meditation, when you have the pranayams you have, should we be doing single pranayama for a longer duration time, or should we be doing all the pranayams at the same single day?
Very good question. When we say pranayama, it's all about regulating breath. So as Dr. Susheel Sharma was focusing, when we do take long and deep breaths, our respiratory rate is going to come down. We keep on giving the example, a tortoise lives for 120 years. Our pet dog lives for 20 years, 25 years. The respiratory rate of tortoise is deep and long. Maybe it has a respiratory rate of 2 per minute, whereas our pet dog has 50 to 60 per minute. So when you regularly practice pranayama, as usual, our respiratory rate is 16 to 18 or 20 per minute. It will go down to 10 per minute. So if your respiratory rate can be brought down to 10 per minute throughout the day, your longevity is going to increase. That's where we say Ayura Arogya Ruddhi. By practicing pranayama, one gets good health, one gets longevity. So these are different techniques. The main focus is to increase your deep and long breath so that respiratory rate will come down. When you practice Anulom-Vilom, it's balancing between the two nadis, Ida and Pingala, balancing between the anabolism and the catabolism. So when you have balance between anabolism and catabolism, you are free from metabolic disorders. So metabolic disorder, when we say lifestyle disorder, there is no other medication but Anulom-Vilom. So you can practice Anulom-Vilom 1 minute, 2 minutes, 3 minutes, that's good. So 1 time, 2 times, 3 times, OD, BD, TDS. So Anulom-Vilom can be practiced 3 times daily, minimum for 3 minutes. Similarly, now coming to Bhastrika. To increase your lung capacity, go and practice Bhastrika. What we are doing? We are going to increase our lung capacity. So if somebody has got COPD, I say OD, BD, TDS and increase the dose by 1 minute, 2 minutes, 3 minutes. So minimum 3 minutes of Bhastrika daily, 3 times a day. So coming to Kapalbhati. So all the metabolic disorders, the root cause is central obesity. To reduce the central obesity, one should practice Kapalbhati. 1 minute, 2 minutes, 3 minutes, minimum 3 minutes per day, at least 3 times, morning, afternoon, evening. So only we tell when you want to practice Kapalbhati, ideally you should be on empty stomach or at least 2 hours after you have taken your food. So when you do practice Kapalbhati, you are going to provide all the exercises for all your internal visceral organs. So Dr. Susheel Sharma keeps on telling the fat that accumulates outside is seen outside, but the inner lining, which is getting inner arteries, which they are getting accumulated all this cholesterol and all. So Kapalbhati is going to help you to reduce the central obesity by giving proper exercise to all your internal visceral organs. Then coming to Brahmari. Your all neurons are going to get activated. So if person who is into anxiety, The solution is Brahmari. Again, 3 minutes minimum, 3 times daily. 3 minutes in the morning, in the afternoon, in the evening. Then coming to Omkar. Oh, deep and long breath with spiritual vibrations reaching every cell of the body. So, in gist, all the pranayamas should be practiced by everybody every day with full focus, with full shraddha. Yad bhavam tad bhavati. The way we feel, we become that. We have explained all these things in every yogasana and pranayama session. Before the session, we have explained the health benefits. So, my humble advice would be everybody must practice the basic pranayamas that we have taught in our IWSP module. The more you practice, the more the benefits. So that's where I said 20 minutes asanas, 20 minutes pranayama, 20 minutes meditation, 1 hour per day for ourselves. Understanding the physical science, understanding the yogic science, understanding the spiritual values as taught by our ancient rishis. That's what in brief about your question. Thank you.
Swamiji, one request, because a lot of people have joined new, and I know there are modules, and you do meditation every time. I think next Sunday you should just take a pranayama. Those people just live. Live has a different meaning compared to module. So if you could do pranayama next time, all the 10 pranayamas that you do for the benefit of all these new participants.
So I will request our Karthikeyan and Naresh to design next week program should be 6 to 7:30. So 6 to 6:20 we come do meditation, then question answer Susheel session, then question answer. 7 to 7:20 we will do pranayama exclusively and we will practice together.
Okay. That'll be helpful to everybody.
We'll do that. We'll do that. Thank you, Dr. Hema.
Yes, thank you so much.
So anybody else, any people who joined our module recently? Yes, sir.
Good morning, sir.
Morning.
Good morning and good evening. I'm Surinder Bandari. I joined recently. And Namaskar ji, and Dr. Susheel and Mrs. Geeta Nan referred, and really I enjoyed a lot, and it is a very helpful, very useful. It was very good. And especially thanks to Naresh for giving me a link this morning for Dr. Rima. That was really wonderful, and really it was very interesting and very educative. So nice. So thanks everybody.
Any questions? Any questions, Surendraji?
No, I'm quite happy, quite satisfied at present. No questions. Thank you very much.
Oh, yeah, go through the modules and then we'll have some questions next time.
I will get.
So he just joined yesterday in late night. Today morning, I just forwarded the link to him asking him to join. Karthikeyan will give the access to all the modules a little later today, sir. Thank you so much.
We have a young doctor, Dr. Mugdha. Mugdha, can you come over, introduce yourself?
Namaste, sir. Am I audible?
Yeah.
Yes, absolutely. Yeah.
I'm Dr. Mugdha Srivastav. I recently finished my M.B.B.S. and I've started volunteering at Ramakrishna Mission since beginning of March. Swamiji introduced me to IWSP, and I have first-handedly seen a patient, type 2 diabetic patient who is in the process of reversing his diabetes off medicines. So that was truly amazing. I came to know about this program from Swamiji only just a week ago, but I have done a complete overhaul of my diet since December 2020. From omnivore I have turned vegan. I consume raw vegetables and fruits throughout the day, and I have seen changes in my life. I am a patient of ankylosing spondylitis, so it has helped me deal with it much better. And this program and the results that Swamiji has told me about has really inspired me, and it was really reassuring. So it has brought back that faith in me for the lifestyle changes. So I enrolled only last night. So this is my first session.
Oh, which hospital are you volunteering in?
Ramakrishna Mission, Kankhal, Haridwar, under Swamiji.
She is volunteering here with us after completing her M.B.B.S. She is here. She is going to plan for her PG in USA. So before that, she wanted to volunteer here. She is volunteering here with us in our emergency ICU and with me, of course. And she is working with patients who have reversed their diabetes. I have given some 2-3 cases. She is going to have a presentation. Maybe she will present her presentation in the next week.
Recording in progress.
So
Go ahead.
I completed my M.B.B.S. from Aligarh Muslim University, and now I'm volunteering under Swamiji only at Ramakrishna Mission.
Thank you.
Welcome, doctor. Welcome to the IWSP family. Any other, quite a bit of new people are in. Yeah, Veena Acharya, please go ahead. Unmute, please.
I'm Mrs. Veena Acharya. I've joined the module since about 2 weeks or so. And actually, I'm a practicing vegan since probably 5 years. I'm do time-restricted feeding since 2 years. I have studied lifestyle medicine. In fact, I'm certified lifestyle medicine physician. And I have reversed my husband's diabetes and hypercholesterolemia using these principles. But I got introduced to this through a friend of mine whose husband, Dr. Shettikeri, is a participant in your program. And I was more attracted because the Western style of lifestyle medicine does not insist exercise as movement. Whereas I was more attracted because this incorporates the yogic practices as exercise. And I know that the mind is a lot more important than a body alone, in both in terms of activity as well as in, so what attracted to me was that the modules included not only about diet, which was I knew I was practicing, I was very convinced, but I wanted to learn more about the yogic practices. And having Swamiji as the other facilitator teacher, and I'm also a initiated devotee of Ramakrishna Math, so that was an additional, attraction for me to listen to Swami Dayadhipananda. So, and that's why I'm here and I'm enjoying the practices. Thank you. Namaste.
Thank you, ma'am. Any doubt, any help? I put the helpline number already. I will be more than happy to help you.
Yeah, thank you.
And anybody else who joined in the last 2-3 weeks who would like to introduce themselves? It is more of an introduction session just to get to know each other. Okay, so I think we don't have anybody else. Dr. Susheel, just one question came after we started the this introductory session. I have heard that patients with high BP should not do exercise that requires you to hold your breath like a plank. Is that true? I know your answer, but still, Dr. Susheel.
When it comes to breathing, again, the answer is same, pranayama. All the basic 5 pranayamas that we are teaching in our IWSP should be practiced by everybody. Even a patient with hypertension should practice pranayama, but with a slow pace. So when you follow IWSP, your BP will come down, you will be off medication. So pranayama is the treatment for high blood pressure. So in the beginning, we say, do it with a slow pace. Anulom vilom. So if you do anulom vilom this way, it must help to reduce your high BP. Similarly, Bastrika. Deep and long breath. Similarly, Kapalbhati. 1 second, 1 stroke. With slow pace. Omkara, Brahmari. All these pranayamas help to reduce the high BP. So when you have got high BP, if you start doing intensely, in the acute phase, it is going to increase BP. But as explained by Dr. Susheel Sharma, in long term, it is going to help to reduce the high BP. So we should understand the things in detail, understand the science in detail, understand the science behind the yogic practices in detail. So when you understand properly and practice over the time, you will be definitely benefited. All the patients with high BP must practice pranayama, must do yogasana, must do meditation, must follow the diet advised here in IWSP. If you do sincerely in 1 month, you will be off your medications for high BP. This is what is exactly being seen in people who are practicing religiously. In the WhatsApp group, we keep on seeing every day our participants come and share their experience. People have reversed their diabetes, people have reversed their hypertension, people have reversed their high cholesterol. People are reversing even their inflammatory disorders like ankylosing spondylitis, gouty arthritis. And we also heard people who got COVID infection, but they did not have any bad effects. They could easily recover from that severe COVID because they continued to practice IWSP and they never went to hospital. They did not take any medicine. And majority of our IWSP participants, they never got infection. So IWSP is the solution for all the health disorders, health issues. Thank you.
Swamiji, one question attached, connected to the same question. Antaka pranayama is okay for high BP patients?
Yes, it is a must. By doing Antaha pranayama, you are going to increase your willpower. Sankalpa Shakti. Willpower is a great thing to achieve great things. So, breathe in, breathe out. Completely breathe out. Hold for some time. This is Bahya Pranayama. Antaha Pranayama, hold the breath. When you are holding your breath, you are going to retain the fresh oxygen for more time in your body. The exchange of oxygen and carbon dioxide in the lung perfusion takes properly. So, Antaha Pranayama gives more time for the exchange of carbon dioxide and oxygen at the lung tissue. That's where it will improve your energy levels, stamina. You'll feel happy, you'll feel light. So, Antaha Pranayama, Bahya Pranayama can be practiced by everybody.
Thank you, Swamiji. With this, there are all the questions are answered. So thank you, Dr. Susheel. Thank you, Swamiji. We will close today's session. And if you would like to join again, you may join another 12 hours. We'll do the repeat of the same session. So with this, we'll meet again next week, same time with a different topic, and look forward to learn directly from Swamiji on pranayama part from by next week. With this, have a great day and have a good night.
Just a minute. Yesterday we had a great talk by a research person at AIMS Delhi, Dr. Rima Dada, who is a molecular scientist who has herself established a very good laboratory doing a lot of researches. So one must listen to her talk, which was given yesterday on role of yoga in treating all the complex diseases. So that will be uploaded in the YouTube soon and will be shared in the group. Please listen to it carefully. Then you will have many more questions to ask in the next session. Next Sunday, IWSP live, morning 6 a.m. We'll be meeting. So next Sunday, it will be little more time, 6 to 7:30. So again, we'll meet. Meanwhile, I request our new participants to go through all the IWSP modules, make your notes, and also have your questions. Your questions will be answered. I also request all of you to practice every day, regularly, without fail, 1 hour for yourself. 20 minutes asana, 20 minutes pranayama, 20 minutes meditation as the highest medication for all the lifestyle disorders. As a highest energy booster for those who don't have any health issues, as a highest thing on the earth available for your joy, peace, and happiness. Thank you. Namaskar.
Thank you, Swamiji. Thank you. We'll close the session today. Have a good day and good night. Bye. Take care.